Scaling is a basic technique in all dental therapy. It is aimed at removal of plaque, the primary etiological agent in periodontal disease, and the removal of calculus and rough cementum, which provide attachment and protection for plaque. The definition of scaling is the removal of calculus, plaque, and other deposits from the clinical crowns of the teeth. There are 5 basic instruments used for scaling at the University of Texas. The mouth mirror, explorer, and periodontal probe, and 3 double-ended scaling instruments, sharpening stones, and sterile 2x2 gauze should also be included on the tray. The first scaling instrument is the U1530 scaler, which is used primarily in the anterior part of the mouth. Scalers like the U1530 are triangular in cross-section and are used mainly on the clinical crowns of the teeth. The U15 is a sickle scaler and is meant to be used on the supragingival surfaces of maxillary and mandibular anterior teeth. Because of its size, the U15 is never inserted deeply into a pocket. The number 30 scaler on the other end of the instrument is considerably smaller in dimension and is used for supragingival and subgingival surfaces of maxillary and mandibular anterior teeth. The Taylor 2-3 is a sickle scaler which has been angulated to allow access to the inner proximal areas of posterior teeth. The Taylor 2-3 is used principally for supragingival calculus on the proximal surfaces of posterior teeth, but can occasionally be passed slightly subgingivally. The Younger Good 7-8 is a curette and is used mainly on the buccal and lingual surfaces of posterior teeth. Curettes are spoon-shaped instruments which present a half moon in cross-section, with the edges forming the cutting blades. The Younger Good curette can be used subgingivally as well as supragingivally. On clinical examination, this patient's gingiva is red as opposed to the normal coral pink color. In texture, it is glossy. In tone, it is edematous, and the papillas are easily retractable, no longer fitting tightly into the interproximal areas. The tissues bleed easily upon probing. The surfaces of the teeth are covered with stain, plaque, and calculus. One half of the surfaces of the teeth will be scaled with the operator positioned in front of the patient. The first instrument used will be the U1530 scaler. The scaler is grasped with the tips of the thumb, first and second finger in contact with the instrument. The fourth finger is used to rest against the tooth. The instrument is passed slightly into the sulcus. The apical portion of the calculus is engaged, and the instrument is activated with a wrist motion. All scalers are used with a pull rather than a push motion. A mouth mirror is used on the lingual for visualization or to provide illumination. The remaining surfaces of the teeth are scaled with the operator seated behind the patient. Scaling one half of the surfaces seated in front and one half seated behind the patient provides more control as well as leverage in instrumentation. The correct finger rest is the primary requirement for careful instrumentation. Failure to use correct finger rests inevitably results in injury to teeth and periodontal tissues. First, the instrument is grasped with the tips of the first, second, and third finger, the fourth finger being used for rest. Secondly, the instrument is passed to engage the apical end of the calculus. And third, the calculus is removed in a pull motion. same principles apply on the lingual. The next instrument used will be the Taylor 2-3. This instrument is used in the interproximal areas of posterior teeth. The instrument is grasped and activated as previously discussed. The mesial and distal proximal surfaces are thoroughly cleaned. The two ends of the Taylor 2-3 are angulated in opposite directions, which allows instrumentation of the proximal surfaces of all posterior teeth from both the buccal and the lingual. The next instrument used is the Younger Good 7-8. This is a curette used to scale the buccal and lingual surfaces of posterior teeth. The cutting edge of the instrument should be placed at an 80-degree angle to the tooth surface. In summary, the U15, U30 is used for supragingival calculus on the maxillary and mandibular anterior teeth. The Taylor 2-3 is used mainly supragingivally on the interproximal surfaces of posterior teeth. The Younger Good 7-8 is used for supragingival as well as subgingival calculus on the facial and lingual surfaces of posterior teeth.